And first of all, can you hear me well? Could you please write in the chat box? Wonderful, good to hear. I should tell you that this webinar is being recorded, and the recording will be available shortly after the webinar together with the PowerPoint. In order to hear us, please make sure that your speaker icon on top of the black bar stays green. While you do not have access to the mic, we encourage you to use the chat box to share your experiences, to ask questions to the speakers, and to share with us your comments. Also, if you have technical difficulties, please write and we will try to help. Without further ado, let me give the floor to Shana, the project manager of the Promise project, to introduce the speakers and the project.
Thanks so much, Judith. Good afternoon, everyone. My name is Shana van Blixen, and I'm from the Council of the Baltic Sea States. We are an intergovernmental organization, and we are also the lead partner on a project which you may be familiar with called Promise. And the presentation is still loading. I will move on. The Project Promise, Promise Project envisions a Europe where the human rights of children to protection from violence, to support, and to be heard are fulfilled. And to fulfill this vision, we refer to the Barnahus model. This is a multidisciplinary interagency intervention for child victims and witnesses of violence. It's a one-stop shop in a child-friendly setting, which fulfills a number of criteria. And in the first phase of this project, now we have a presentation. Maybe you saw it before I did. And in the first phase of this project, we explored these criteria in depth and developed standard-setting publications. In that process, only select professionals could join us. But now, with this webinar series, From Zero to Barnahus, it's an open invitation to join the discussions within the European Barnahus movement. And in this webinar series, we will continue to discuss and discover key principles, standards, and challenges to consider when opening and operating a multidisciplinary interagency collaboration for child victims and witnesses of violence. And we hope that you will continue to join us for this. You can read more about the principles, standards, and challenges in the Promise Vision, which is in a link on your screen, and also, I think, in the web links section right just down below. Back when we first started, about 3 years ago, we invited pilot countries to participate in exchanges and trainings. And now, in phase 2 of the project, these countries are facilitating their own exchanges and trainings, and all the while they've been supporting the European Barnahus movement, first by giving important feedback to our publications, and now with their own learnings. So 3 years ago, about 6 countries or so had a Barnahus or similar setup. By the end of 2019, we think that at least 20 will have a Barnahus or similar setup operational, with another 6 or even more countries actively working towards launching their services. And incredibly, most of these have either inspired, contributed to, or are basing their work on the Barnahus quality standards and on the other valuable learnings that we have developed in this project. And you can read about those standards and publications in many links down in the web link section below. And without any further ado, I want to introduce our speakers, actually, and sort of the format of how this webinar will work. So we have our main speaker today. It is Stefan Rune from Karolinska University Hospital in Sweden. And we also have, you'll see on the screen, Andrea Goddard, and I think Resmiye will join us as well. We're still working on getting her in. But the idea here is that the main speaker will give the main presentation, and then the contributing speakers at the end have an opportunity to give comments and also participate in answering the questions that you may have, which you will write in the chat, we hope. And that way you get a bit more of a varied perspective from different countries. So we have Sweden and the United States, and we have London. And of course, all of our speakers have been working around the world with the same topic, so they have a lot of expertise to share with you today. You'll note that our two contributing speakers have their own webinars coming up next week. Resmiye has a webinar on diagnostic workup and decision-making in physical abuse, and in the middle of November, Andrea will have one on sexual abuse. And without any further ado, I would like to invite Stefan to turn on his microphone and take the floor and give us the framework for medical standards.
Okay, thank you, Shauna, and thank you so much for inviting me to be part of this webinar from Stockholm today. My name is Stefan Rune. I'm a pediatrician working in the Barnahus in the center of Stockholm at the moment, and that's where I'm placed talking to you today. I will talk initially today. This talk will be about the framework and actually where the medical sort of exam and the medical point of view will come into the work in Barnahus, and that's what we're going to focus on today. And also, so a lot of discussion is going to be how and where are we working, and then Resmiye and Andrea will go into more specifics in their talks about the specifics about the exams we do with the children at Barnahus. Yes, I always want to start with this when we talk about Barnahus, and actually when we're doing anything about children, it's the sort of the golden rule should apply to all the actions concerning children, is that, you know, regardless of the legal outcome, they should be in a better position sort of when at the end of the process, because we are there for the children. We're not there for the legal outcome. We're there to make it better for these children, and that's, I think, must always be in the front line when we think about children, that we're there to help them and make it better for them, and not just have a smooth process or make a good workplace for us others, but we must have the children in the front line when we're working in this process. So we would very much like to understand a bit about who is listening in today, so we get a bit of a better understanding from what sides of the different professions that we have in the Barnahus movement, or where you work today, and that will sort of maybe help us to focus more on what the talk will be about, the framework today. So please fill in the poll that's just up on your screen now, and hopefully we'll be able to address you a bit more along the way of this talk, and also when we have the questions. Okay, good. So very good. Answering on there. So yeah, I'll get back to you on that, and we'll just keep on going, I think, at the moment. Okay. Good. See all the screens coming up, and it seems to be from all parts of this setting. So that's really good, and thank you for joining us today on this talk. Okay, very good. Yeah, okay, good. Perfect. Okay, I'll move on. Okay, so this is where you all been from, and I just want to show you this picture. That's sort of there's some Swedish in the middle here, but we've got some English on the outside, so you can see a bit where we are. And the framework is that the one-stop shop that Barnahus is, that we have the forensic interviews, and then we come into the medical and forensic examination, including maybe dental, and then we have the risk and protection assessment and the crisis support and treatment. And as we try to emphasize is that the different parts of Barnahus have a equal should have an equal say about the child in the setting, and that's sort of to see that we really see to all the child's needs in this situation. It's very important to understand that the child needs all this, but maybe sometimes and in many settings sort of the forensic interview sort of becomes the really big part of the Barnahus work, and maybe sometimes the other parts are set aside to make a good forensic interview. But out of a legal perspective, I understand this, and it's important that we hear the child in a good way and it gets its say. But for the general well-being of the child, I think it's very important to keep the other parts of the Barnahus parts of the medical, the risk protection, and the crisis support and treatment is equally as important for the child as an individual. So it's good to keep that in mind. So the quality standards when it concerns about today's talk is the medical examination, and it's just one part of the Barnahus, and it's very important that when it comes to making this standard work is that there actually is someone there who can do the medical exams, and it should be carried out in a quite routinely way and as close to the services as possible. The staff should have a knowledge about what to look for and also understand these children where they are in their situation, and not only maybe understand bruising and physical signs, but also the emotional and especially that the most common part of child abuse is neglect, and understanding signs and symptoms of that is very important. The staffing, as I said, is can be a varied part, and it's just to see that the staff that do this and then have the sort of the medical part of Barnahus has the right competence for the job, and understanding all the parts of the child's needs when seeing to them. It's of course that we have that you are have good know-how about the special procedures and how to work your equipment, because the child usually, I mean, in the older ages it's fine to just talk about that, but the smaller children will not wait for you. So it's very important to know what you're doing and know your equipment. When it comes to understanding your part in the Barnahus as a medical profession, I think it's very understanding what the child's needs can be outside the Barnahus, and seeing to that you have a collaboration, especially maybe with social services, or in outside the Barnahus, you might need even to contact and talk to the caregivers about this child that you have seen, and also see to that they get the follow-up that you think they're entitled to or need. I think it's understanding the Barnahus, and this is why I want to ask this question at this point, is that you maybe will reflect a bit on seeing, you know, the description of the Barnahus with the different views from the forensic interview to the crisis support and the medical examination, and also child protection services. I would be happy if you just give a bit of a thought what you think would be the most winning with using a Barnahus or a similar concept when processing cases about children like this. So please just tick a box, and we'll look at the results here after a while. I'll give you a couple of seconds to just reflect on the different answers here. Okay, I think you've clicked here, and as a pediatrician, I'm happy to see that the child-friendly option is well voted for, and I think this is in a way important to understand that we need to be child-friendly, and not and in that, what I'm not saying, we should not be childish in any way, but we should be child-friendly and understand the needs of the children that we hear, and do, especially about information about how the day will be at Barnahus, how the forensic interview, the examination, how everything is going to happen to the child, that this is done in the child's on the child's level of understanding and very clear. And I think me putting up the child-friendly option is probably the one that I bet what I was thinking about, that we're not talking anyway to run around and be childish in any way, but being child-friendly and understanding the child's needs for good information and being part of the day and understanding what we're doing at Barnahus. Thank you so much for your answers. We'll just go on, and I want to talk now a bit about Barnahus Stockholm and the local example of us here. So Barnahus Stockholm is one of 7 Barnahus in the greater Stockholm region. There is about 1,000 children every year coming through, and the age groups are from about 3 to 4 years of age, so it's when you can actually do a forensic interview with them, and we see children up to the age of 18. The age groups that are not most common that we see here is around 6 years old and around the 14th year, and that's somehow when the children start to speak, when they start school in Sweden. It's about 6 years of age, and they also be more verbal, and that's probably why they start talking about what's happening to them in the home or what has happened to them. And in the early teens, that's also when you've sort of had enough, and you sort of take a stand about who you are and what you are as a person, and you start telling people around you what's happening to you in the home or what has happened to you outside the home if you've been in any way abused. Unfortunately, today we only examine about 15 to 20% of the children that come through Barnahus, and it's a constant sort of work we have that we would like to see more of these children, and we're working with our attorneys and the police to sort of talk about what the gain is for the child to actually be examined. And in Sweden, I can see the question coming up here on the chat, is that in Sweden it's the it's actually the prosecutor who has the say in if the child should be examined or not. So I as the medical profession at Barnahus, I can only inform and I can recommend warmly that the child should be examined, and why I think so, even if the child maybe not had expressed or told anything in the forensic interview about physical or any other abuse. We still say that it's such a risk factor that you've even ended up in the Barnahus. If you're a sort of a child that comes to Barnahus for a forensic interview, you're a child at risk, and that means that there are other things around, not just maybe physical abuse that the child is here for, and there are other key factors of that the child is not well, or there are some social or other difficulties in the family that should be addressed. And also we think that we can be the gateway to helping social services or this child to sort of come to a, as we said, the golden rule that they will be better off after this process, and we can contribute to that. But so far we are getting a lot. We have a lot of education with our prosecutors and also with our attorneys about why children should be examined at Barnahus, even if they don't, display anything in there or tell anything in the forensic interview. But it's ongoing work, and I think we're getting there. And the biggest part of us getting there is actually being here, being at Barnahus, being in the collaboration, and being active in the child's, especially before the child comes to the Barnahus, before where we have the sort of the talking about the child, the multidisciplinary meeting that is done before the child comes to Barnahus. And that's a very important place where we sort of express why the child should be examined. What crimes do we see here at Barnahus Stockholm? Well, as you might know, it's mostly physical abuse, and that's because corporal punishment in Sweden is by law forbidden since 1979, and that means that we get mostly physical abuse, but we have 1/3 about sexual abuse, and some of especially internet-related grooming is also on the move, and that sort of would be in the green sector here. The other, the yellow sector is where you would say that the child has been sort of limited or constantly, someone would say more physical abuse in a way. So it's a bit part of that as well. The staffing, as we talked about earlier, this is very important to see that. Sorry, I was just reading a question here at the same time. I'm sort of not very. I'll just move the signs down. Sorry, I'll just be with you in a second. Here we go. Here we go. Where is it? I lost it. Okay, I'll come back to it. Sorry. So the staffing here is important. As I said, it's of essence to be in Barnahus and being around the different parts of it to understand what we're doing. So we all get a glimpse of our different professions, and that makes a better understanding, and the collaboration will be more active. At Barnahus, we have a management team that is one of our managers from each sector, from the police, the social services, mental health, and health sector. The social services are the coordinators So we have them sort of connecting with the local social services when the child comes to the Barnahus. We have investigators, of course, and the children's mental health helping out with the trauma treatment. In the child protection team at the moment, we're 3 pediatric specialist nurses and 3 pediatricians working half-time, and we also have sort of working in the hospitals half-time, which makes us more available, I think, in a good way to our staff at the hospital as well. And of course, 3 public prosecutor offices are connected to us to make the whole thing work. I will, in the last part here, just talk about the general exam and how we approach the child, how we do the exam, and things about that, sort of a bit of a frame. I think it's very important that the child, as I said earlier when we talked about being child-friendly, that everybody who is around the child has good information. In our setting, usually they will come from daycare or from the school with a legal counsel and also a safety person. These 2 persons are very important for the child, and they must know what's going on and must be well informed. When the actual forensic interview is made, we meet up with the child in the waiting room. We, as the child probably hasn't been informed earlier on, but you know, they won't remember that, so we'll take it again and talk about what the exam is about, and helping them understand what's going to happen now. When we come into the examination room, we sort of sit down and we talk about it again when it's actually going to happen. And then we try to proceed quite quickly to, you know, get going with it. So they, you know, they understand what we're doing. We tend to be very open about what we're doing, that we're taking pictures and why we're taking pictures, and as the child has had its forensic interview, we're very open about our questions, and we talk about bruising and other signs that we can see, and what they think about that, and so on. And it's very important to have time, even if you don't have it. You don't not show that you're rushed in any sense, and also sort of listening to the child. These are children that usually not have been listened to at all, and they haven't met maybe as good examples of adults before in their life, and therefore you or we should be the ones that they can trust and understand. And I think that's very important. Besides the actual looking at bruising and you know, doing the actual forensic work, it's, as we're talking about children, child growth is a very important factor, and that we should measure and weigh them when we're here. If you have in any way a possibility to get hold of the growth charts, in Sweden we have computerized notes, and I can get hold of the child care center's growth chart by a couple of clicks in the computer, which makes it quite easy for me to understand if this child is growing as it should or not. We can also, as just in the last year about, we have had a dentist connected to our team, so we have the possibility to get hold of dental records, or at least check them afterwards, and see how that how the child's dental health is. I'm a pediatrician, so I would say that the mouth is sort of a bit of a black hole for us when we look at it, but I've become better now having a dentist over my shoulder from time to time. But it's a very good thing to actually look in the mouth and actually check the teeth. It's just as we know, it's extreme. It's sort of tells you a tale about that this child has been neglected or not taken care of if they have a lot of tooth caries in their mouth, and I think that's very important to check. The general presentation, as always, is good. How do they act in the room? How are they dressed? And of course, if you find the eczema spread over the body, or if you in any way understand that this is untreated asthma or anything like that, I think it's very important to address that. To understand that there is so I think you should address that, and we have the possibility to write so we can sort of refer it to medical specialists. This is, of course, you have to talk to this about to the children, and also to the social services, and in the long run, of course, you need to talk to the parents about this if the child goes back to the parents or not being in any way prosecuted in that way. I think I saw some question if the prosecutor would object if I just took hold of the child and examined it, if I find it in the corridor. I guess not. I think we could do that. If we, of course, as we're working as trying to work as a team here, I think they would be a bit as they feel responsible for the case and for the child when they're here in Barnahus. I think they would not really think that's they would be. They would think probably they are overstepping my sort of boundaries or what I'm allowed to decide. But so at the moment we're working the way around it to talk to them instead and trying to explain the importance of having a medical exam for the children. Let's see if I had some other questions. Okay. Yes. So there is something about in the chat about the paid centers. We don't have in Sweden. We're all sort of paid individually by our each specialty. So I'm on the payroll from the Karolinska University Hospital, and the prosecutors are from the state and so on. So and that would not be a problem. Sort of doing more medical exams, that wouldn't cost more. As we're here and we're present, so we would rather do more exams than do other things, because we're here for the children, of course. I see if there is any more questions at the moment. I'll just. Okay, so I think I'm coming a bit to the end of my exam. I'll just talk about the so the room sometimes is. I think it's important that you don't need really a lot of equipment. It depends a bit on what you're doing. I think if you're doing more sexual abuse cases and seeing children in the acute phase, if they should, I think you would need more medical standards or hospital settings maybe. And I mean, as it said in the standards as well, if you have a child who has a medical problem that needs admission or needs surgery or anything, the child should of course be examined and taken care of in a hospital setting, and maybe not in the Barnahus setting as it would be. But many children that we see, it's been a bit of a time lag before we see them after the actual place or after the timing where something has happened to them. Yes, so of course I do photo and written documentation, and I think as the education of the other parts of Barnahus, I think it's very important to spread the word and around the need for medical examination in Barnahus as a part of making the process better for the child, and seeing to other needs than judiciary, and also maybe being very clear on the understanding that even if there are no findings, physical findings on the child, it does not in any way sort of doesn't make the child's story less credible, and I think that's something we're working with our prosecutors a lot today. I think that's what I actually wanted to talk to you about today. Being clear on the forms of the medical exam in the Barnahus, and that we're a true part of Barnahus and a cornerstone together with the other four corners of the Barnahus, and making the process sort of giving the child being there some value, and that it should be better in the end when the child comes out on the other side of this process. At this point, I think we're should be open for questions, and also if Andrea or Resmiye would like to comment on anything at this point, would be fine.
In fact, Resmiye and Andrea should start your cameras and also your audio. That would be great. Thank you so much, Stefan.
Thank you.
I think it's quite an interesting comment that actually one of the most helpful things that you've seen in terms of changing people's minds about the importance, or not changing, really emphasizing the importance of a medical evaluation is in fact being there already. It's sort of a chicken and the egg thing, which comes first. It's quite common for many services to start actually without a strong medical evaluation presence in their service. So it's nice to hear that having it there really makes a difference in teaching all the different professions the importance of that vital service being there and being part of the routines. Andrea, it looks like you have managed to get your video and audio going. We'll give. Yes, we can hear you. We'll give Resmiye another moment to see if she can make hers work. But I guess, Andrea, do you have any first reflections that you'd like to share after Stefan's?
No, I think the models are different in the order that steps are taken in every country. And as I was involved in Promise One, I became aware of the variations. The overall principle is exactly the same. That is, to make it very child-friendly and not re-traumatizing. But I think we were very lucky in some ways in the UK that there was already a strong tendency towards examination as a first step coming from social services, and depending a little bit on what's happened, that tends to be quite an initial step, and then often the interviewing takes place. But I think it's equally important to not only are we examining the children to find some evidence, but we're also examining them, and this is a really key point, to provide reassurance that everything is okay if it is okay. And that's especially the case in sexual abuse, that usually we don't find anything, but that in itself is quite helpful information for lots of children and their parents.
Absolutely. Thank you so much for sharing that perspective. It is indeed, of course, an important service to an important part of healing, feeling yourself like you are okay. Absolutely. Resmiye, do you?
I guess the other thing is...
No, you can go ahead.
Sorry. So the other thing is that, you know, a lot of these children, on the other hand, are in a sort of situation where their medical care, despite, you know, the National Health Service, they may be neglected as well as being abused in other ways. And, you know, the thing, especially the dental thing, I mean, you know, we often pick up terrible dental caries and other, you know, illnesses that are not being as managed as well as they could be. So, in fact, our aim should be to improve the overall health of the child in every dimension, I think.
Absolutely. Resmiye, do you have any comments?
Do you hear me?
Yeah.
Yes.
Yeah.
Okay, good. So I actually would like to second what Andrea said, and I tried to type in the problem with our Barnahus here in the U.S. Just like in Sweden, prosecution, law enforcement, and or child protection services bring children to Barnahus in the U.S. with a set set of recommendations or requests, set of requests. So they may say we want only forensic interview, they may say forensic interview and medical exam, or they may say we want only medical exam. Forensic interview, I don't care about because it is part of the litigation system, so they should have full control over whether forensic interview will be done or not. But for medical exam, I think we should be, the pediatricians and the physicians in Barnahus should be the one making the decision, as long as the law doesn't say you cannot conduct, let's say, genital examination on this child. I think any child that walks through the doors of the Barnahus should get at least a general medical examination, and on a case-by-case basis, and because with sexual abuse cases, I think every child should get a genital examination. But for physical abuse cases, if it's a 14-year-old and the child definitely doesn't want to have genital exam, I don't think she should be forced for that. But I think I agree with Andrea. Medical exam may reveal certain things that nobody knew about this child, and other categories of child abuse and neglect may also be revealed as a result of medical exam. In the U.S., the driving force is funding. So whatever the referring entities request, that's what they fund. And if a medical examination is requested by prosecution or whoever requests it, they have to pay for it. As a result of that, they have an incentive in not requesting medical exam unless it's a sexual abuse case or physical abuse case with findings. And unfortunately, our physicians, a lot of our physicians in the U.S. Barnahus system go along with whatever the referring entities request. And I find it a missed opportunity, and for the new Barnahus people in the process of establishing your Barnahus, look at your own country's laws and connections among the agencies in your locality, and from the get-go try to establish that every child that comes through Barnahus is going to get a medical examination. That's what I advocate for.
It's really, really good and really important advice. Thanks so much. So, Stefan, you were you were talking about dental examination, and that seems to be something that is becoming more popular amongst some established Barnahus that I know about are starting to include dental examination. And Andrea and Resmiye, are you also working with dentists?
We don't actually. Sorry, go ahead, Resmiye.
Oh, well, that was a very impressive finding from your presentation, Stefan, among other things, because I'm not aware of probably the largest child advocacy centers in the U.S. may have that, but the Barnahuses that I visited in the U.S., I've never seen a dentist being involved. So that's a wonderful, wonderful thing to have, but it depends on resources, I guess.
Yeah, it would, and I mean in the Swedish setting, so we've had quite a good sort of general. So it's dental care is free for all children, and sort of been through decades, and therefore we've had the dental sort of health in children is so good, so you can sort of, if you look in the mouth in a child and it has caries, then that's a sign that sort of there is something wrong here. There is neglect, or so you can almost just use that as a sign. You don't have to actually do any more examination or talk to the child even more than that. So for the Swedish setting, it's been so clear that we need help in this, because it's such a key point for us understanding if this child is sort of has other symptoms or symptoms of neglect, and this is sort of a key feature for that. So that's why we sort of started to collaborate with a pediatric dentist. So it's been rewarding, because we're sort of understanding more about this problem than we did before.
I want to move to Sweden. Find a job there.
Andrea, what about in England?
No, we're a bit like Stefan. We certainly don't have dentists in the team, and we open the mouth and look and see what's going on there. And there are a group of children who have really poor dentition, and dental care for children is free. It's more a problem, slight resistance on the part of dentists. One, the parents actually need to get an appointment and take the child to a dentist too, and a lot of children hate the dentist. Three, so they're the kind of issues that we might have.
Yeah, definitely. And also children maybe with some sort of a physical handicap or cerebral palsy or any of the developmental delays are often a problem, for dental health. But in that sense, they're also a risk group for abuse as well. So it's sort of a difficult equation sometimes to actually understand.
Definitely, and for those more complicated cases, we do have specialist hospital dental services, but not in our setting. We would have to refer.
No, and I would say if you're starting up a Barnahus, sort of, I think the most important thing is to have medical staff there. I think a dentist is a bit down the line. The most important thing is actually that when you start off with all of the four parts of Barnahus. I think you will have a better start, and you will also understand more about seeing the whole concept and the whole part of the child's needs. I think that's very important.
It's an important point. Thank you so much. Stefan, there was a question from Michelle in the middle of your presentation about, do you know how many are examined in the CSA group alone? Is it still 15 to 20%? It was with the pie chart with the child sexual abuse cases. How many of them are examined?
No, they would be, but they wouldn't be examined. So in our setting, they would be examined at the emergency room, in the child's emergency, the first exam. We would do the follow-up, the 3-month follow-up here. So in the acute setting, they would, at this point, we're working on that, but they still would go to the emergency room for an exam in the first. So that's why they wouldn't be examined here at Barnahus as of now.
So Stefan, I have a question. Even if it is non-acute sexual abuse,
yes.
Do they still get the physical exam, medical exam in the ER?
No, then okay, yeah, that's good. Yeah, that's a good point. No, then we would see them here, of course. Yes, as you've said before, and as Andrea as well said, it's very important to see these children and talk about what they look like, and that they look fine, and that everything looks okay. As many, especially teenagers, think they actually have a sign in the forehead that said that I've been sexually abused, and you sort of have to tell them that no one can see that you've been sexually abused. We had a couple of teenagers a year ago that was sexually abused for months by their gym teacher, and they were here, of course. I mean, they didn't have, it's not an acute exam, but they were here, and we met with them, and we talked about, what they looked like, and they looked fine, and these boys were sort of worried, and they didn't say much, but then actually when leaving, he opened the door, and then he closed it again, and then turned to me, and he said, "So I look okay then?" So he had sort of thought it through while we were talking, but he didn't really want to ask, but then he did, and then I said, "Yeah, you look fine, everything's okay," and he go, "Okay," and then he sort of left, and then you feel like, well, okay, we did a good thing here. I mean, it wasn't, the prosecutor didn't get anything out of it, no one actually, but the child won. He got something out of it, so he sort of understood that he looks fine, and I think that that sort of made my day a bit.
And that must feel really, really great when you get a result like that. And at the end of the day, the whole purpose of Barnahus is supporting the child, putting the child at the center, and to get that kind of support is a really special thing for a lot of people. There was another question about if you ever examine children who have not received an interview or have not been interviewed.
We could, in our setting, we could examine them out of the social services. They could ask for an exam. So that would sort of bypass the prosecutor. They could do that, and they probably have to have both parents be allowed, that both parents had to say yes to an exam like that. If the child is not taken into care, sort of, if it's in the care of social services, they have full responsibility. They can bring the child to us for an exam. So
even in cases where one of the parent is the possible offender, or?
Oh, well, it depends. If the child is still in the care of parents and the social services haven't taken over the care, it's still the parents who are the guardians, the legal guardians, so they have to say yes to an exam. So we can't bypass that. What we do here at Barnahus is for the 3 to 4 hours that they're in Barnahus, the court will address attorney to be the legal guardian of the child from the time it's taken from school until it's left, it's taken back to school. And at that point, it's actually the attorney who's appointed by the court who has the right to say what should and should not be done with the child during the time at Barnahus. And we have sometimes attorneys who are worried about us seeing the child, even if the prosecutor would like the child to be examined, even the attorney can say no. That unfortunately that can happen as well at times. And that's usually they don't understand what we're doing. They think we're sort of re-traumatizing the child again, or taking all the child's clothes off and just walk around and poke it somehow. So it's a lot of education goes into explaining what the exam is, that it's this that Andrea and Resmiye talk about, that we sort of interact with the child and tell them and give them a support what their body is and who they are as children. I think it's very important to meet them, and I think that we do that well. So
I think that's. Anne Frank has another question, but how about kids at age 2?
Oh yeah. So these children would not be interviewed. So would they be in the Barnahus? It will be. We would sort of talk to the prosecutor about that. We want to see all the children in the family who is in Barnahus. Unfortunately, we don't always get hold of the small ones, as they would be in the home, and if they don't want to tell the parents about this exam, then there would be a problem. But we talk to social services usually when it's a family like this, and we try to support social services to understand the importance of a medical exam around this. And all children in Sweden who are taken into care with social services, they would get a medical exam, not by us, but by a pediatrician in an outpatient setting.
Thank you so much, Stefan. That is about all the time that we have for today, but I wanted to give both Andrea and Resmiye maybe just like one little snippet to say what your upcoming webinars are about. Maybe, so Resmiye, it's actually yours next week, 25th of October.
So, what I am going to do, actually, this webinar was very helpful to perhaps reshape some of my slides and content. May I ask you something, Shauna? How many people attended this webinar?
This one we have 27 people attending right now.
27. And are these people going to attend the other sections as well? Or
I sure hope so, everyone.
Of course.
Register down below.
Of course they will.
Just like Stefan alluded to or mentioned, that every Barnahus should affiliate with a hospital setting so that the severe physical abuse cases and perhaps criminal neglect cases that end up being admitted to the hospital, or sexual assault cases with injuries, they also end up being admitted to the hospital. Those patients also are managed at the top quality of services that Barnahus is able to provide on an outpatient basis. So I'm going to try to combine the Barnahus medical service with a hospital-based multidisciplinary team that provides similar services to a more high-profile child abuse population. That's what I'm going to try to do, and walk you through the diagnostic workup that is necessary for these severe physical abuse, criminal neglect, and acute sexual assault cases.
Perfect. And Andrea, on 19th of November, you're going to be talking, oh, I see a typo in my slide, sexual abuse diagnostics. Tell us more.
Okay. So I, very much along the lines of Stefan, I'm just going to go into a little bit more detail about how we would actually go about that. And it actually starts with, a multi-agency conversation, a decision to examine the child sooner or later, a lot about consent, particularly in adolescents, because we have to take it at their own pace to some extent, and then just some of the medical aspects of examining the child and then caring the child and making sure all the right follow-up steps are taken. And I'll probably repeat several times, the value of actually being able to tell the child and the parent that they're fine, like the boy who asked as he went out the door in Stefan's case. Because that is really, really therapeutic. I think that's the best thing we do, actually. So I might labour that point.
We look forward to that, and we look forward to seeing all of our speakers are going to continue to try to join us in the follow-ups. They might not all be able to make it, but I think if you'd like this format, let us know. And with that, I want to thank Stefan and Andrea and Resmiye for your expertise, and this has been such an engaging and thoughtful presentation and question rounds from everybody. Thank you so much for joining. And now I should turn it back over to Judith for the final word from Child Hub.
Thank you.
Thank you very much. Thank you to the speakers, and thank you, Shauna, for the excellent facilitation. We're very happy to join you for this series of webinars, and we do hope that our listeners are also doing this. I just wanted to encourage you to subscribe to our newsletter so that you remain updated on what we are planning to do in the future. And also, I should remind you that in case you're interested, we can provide you with certificates of attendance of this webinar. So if you are interested, you will see the info@childhub.org email in the chat box where you can ask for this certificate. Thank you very much for being with us, and hope to hear and see you back next week.
Thank you.
Nice to meet you, Stefan, and good to see you, Andrea and Shauna.
You too. I agree, Stefan. Great talk.
Yeah, wonderful talk.
Thank you.
You're doing
Thanks,
a
everyone. See you next
fantastic
week.
job. Bye-bye.
Bye.
Bye. Good.